Hello everyone, welcome to BOOKWORM. Today we are going to talk about something that affects millions of people worldwide but is often misunderstood: depression. Depression isn't just about feeling sad for a short period of time, it's a mental health condition that deeply affects every aspect of someone's life. So, what exactly depression is and why should we take care of mental health? Let's dive in. What is depression? Depression is a mental health disorder that can make you feel overwhelmingly sad, hopeless, and disconnected from the world around you. But it's more than just a fleeting mood or a reaction to a difficult event. Depression is persistent, often lasting for weeks, months, or even longer. It can manifest in many ways. You might feel exhausted even after a full night's sleep, or you may have trouble concentrating on tasks once you've enjoyed. People with depression might isolate themselves, withdraw from social activities, and find difficulties to complete everyday tasks. Physical symptoms are common as well, such as changes in appetite or sleep patterns. Depression doesn't always show on the outside, which is why it is called sometimes invisible illness. Many people may not recognize the signs, and others may feel too ashamed or embarrassed to seek help. It is important to remember that depression is not a personal weakness. It is a complex mix of genetic, biological, environmental, and psychological factors that contribute to it. And like any physical illness, depression requires attention, understanding, and care. Why mental health matters? Mental health is a critical part of overall well being. Just as we take care of our physical health by eating, doing exercise, and getting enough sleep, mental health needs attention too. Mental health affects how we think, feel, and act, and it shapes how we handle life's challenges. When we take care of our mental health, we are better equipped to deal with stress, build healthy relationships, and enjoy a fulfilling life. On the other hand, ignoring mental health can lead to various issues, not just mentally but also physically. For example, chronic stress or untreated mental illness can lead to heart problems, digestive issues, and sleep disturbances. It affects our immune system and increases vulnerability to other illness. When people struggle with mental health issues like depression, they may have trouble focusing, functioning at work or school, and maintaining personal relationships. Depression, if left untreated, can lead to self harm or thoughts of suicide, making it one of the leading causes of death globally. But the good news is that mental health can be treated, just like someone would visit a doctor for a physical pain. It is essential to visit a mental health professional for emotional distress. Therapy, medication, lifestyle changes, and self care practices can all play significant roles for managing mental health and overcoming depression. So, now that we understand what depression is and why mental health is important, let's briefly discuss the real life story of a Bollywood celebrity who went through depression. So, now that we understand what depression is and why mental health is important, let's briefly discuss the real life story of a Bollywood celebrity who went through depression. In 2014, Bollywood star Deepika Padukone was at the peak of her career. Her films were breaking records, and world saw her confident and successful actress. But behind the glamour, she was fighting a silent battle: depression. She didn't understand why she felt constantly exhausted, empty, and disconnected from life. Despite having loved family and friends, an unexplained sadness consumed her. There were days she didn't want to get out of the bed. Simple things felt overwhelming. One day she finally opened up to her mother, who noticed changes in her and encouraged her to seek help. Deepika consulted a therapist and started medication. Through professional help, support, and self care, she slowly began healing. Instead of hiding her struggle, she did something powerful. She spoke about it openly. In 2015, she launched the Live, Love, Love Foundation, dedicated to mental health awareness. Today, Deepika is not just an actress, but a voice for those who are struggling with depression, reminding the world that mental health also matters and seeking help is a sign of strength but not a weakness. Depression doesn't have one simple cause. It's usually a result of combination of factors which can vary greatly from person to person. Some of the most common causes include genetics, chemical imbalance in the brain, chronic stress or trauma, life events, medical conditions, social isolations. The first one is genetics. A family history of depression can increase the likelihood of developing the condition. If someone's parents or close relatives had depression, it could pass down genetically. The second one is chemical imbalance in the brain. Depression is believed to be linked to imbalances in the chemicals that regulates mood such as serotonin and dopamine. These imbalances affect mood, sleep and appetite, contributing to depressive symptoms. The third one is chronic stress or trauma. Long-term stress from work, relationships or financial conditions can lead to depression. Similarly, past traumatic experiences such as abuse or loss of loved one can lead to depression. The fourth one is life events. Major life changes such as moving to a new city, losing a job, or going through a breakup can lead to depressive episodes. The fifth one is medical condition. Some of the medical conditions such as chronic illness, heart disease, or sleep disorders can contribute to depression. Additionally, some of the medications can lead to depression as a side effect. And the last one is social isolation. Lack of support or feeling loneliness can contribute to depression. Isolation can make others to feel loneliness or sadness or hopelessness more intense. So let's have a look on diagnosis and treatment. Diagnosis of depression. Depression is diagnosed by mental health professionals based on symptoms, duration, and impact on daily life. It's not just about feeling sad, it's a persistent condition that affects thoughts, emotions, and behavior. A common diagnostic steps: clinical interviews. A psychologist or psychiatrist asks about mood, behavior, sleep patterns, and past experiences. DSM-5 criteria. Doctors use the Diagnostic and Statistical Manual of Mental Disorders to check if a person meets the clinical criteria for depression. Physical exams and lab tests. Sometimes medical conditions like thyroid problems or vitamin deficiencies can cause depression-like symptoms. Questionnaires and self-assessment tools. Patients may fill out depression screening tests like PHQ-9 questionnaire. Example, if someone has felt hopeless, had trouble sleeping, and lost interest in daily activities for more than 2 weeks, they may be diagnosed with major depressive disorder (MDD). Treatment of depression. Treatment depends on the severity of depression and can include therapy, medication, and lifestyle changes. The first one is therapy and counseling. Psychotherapy, talk therapy, is one of the most effective treatments. Cognitive behavioral therapy (CBT) helps change negative thought patterns. Interpersonal therapy (IPT) focuses on improving relationships. Mindfulness and stress management teaches relaxation techniques like meditation. Example, a person struggling with low self-esteem learns CBT techniques to challenge negative thoughts and build confidence. The second one is medication. In moderate to severe cases, doctors may prescribe antidepressants to help balance brain chemicals like serotonin and dopamine. Selective serotonin reuptake inhibitors SSRIs like Prozac, Zolo-FT or Lexapro. Serotonin norepinephrine reuptake inhibitors SNRIs like Cymbalta, tricyclic antidepressants TCAS and MAOIs, older but still used in some cases. Antidepressants take 2 to 6 weeks to show effects and should only be taken under a doctor's guidance. For example, someone with severe depression who has difficulty getting out of bed may benefit from SSRIs to improve energy levels and mood. The third one is lifestyle changes and self-help. Sometimes small daily habits can have a big impact on mental health. Regular exercise boosts endorphins, the brain's natural mood lifters. Healthy diet, omega-3s, whole grains and protein help brain function. Proper sleep routine, lack of sleep worsens depression symptoms. Social support, talking to friends, family or joining a support group. For example, someone experiencing mild depression starts morning walks or journaling to track their emotions. Over time, they notice improved mood. Depression is serious but treatable mental health condition that affects millions of people worldwide. It's not just sadness, it is a complex condition that affects emotions, thoughts, and daily life. The good news is help is available, whether through therapy, medication, lifestyle changes, or social support. Recovery is possible with the right approach. If you or someone you know is struggling, don't hesitate to seek help. Talking to a friend, family member, or professional can be the first step towards healing. Remember, you are not alone, you are valued, and there is always a hope. Stay strong, stay hopeful, and take care of your mental health.